The following program is a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of News Channel 11.
Here at Renovus Day Spa, we do a lot of color chasing. People come in because of browns, reds, blacks they don't like. What are we talking about? We're talking about vessels, hair, brown spots. They like to call them age spots. They're not. They're maturity spots. They're just the signs of getting a little older and doing things that you weren't supposed to do. So one of the things we chase is leg veins. Different size, small veins, large veins. But we've got a patient here now with the little small veins, and we're going to talk about using a laser. And so if we can go ahead and get started with this, you're going to see that with this laser, we can go ahead and target the blue color in her veins. Now, if they were red, we would use a little different laser to go for the red spots. But using this laser, and you can see she's not jumping, it really doesn't hurt. There's a little cryogen, a little cool device, cooling agent that goes to the skin immediate split second before the laser does. And the laser is actually destroying those blood vessels. So we can treat small veins on the legs and on the face with just a small amount of time on there. Another thing that we chase in colors are going to be the brown spots, the lentigos, the sunspots. This isn't from age, this is being out in the sun too many years. So we're going to chase this one with a different laser, looking for a different color, in this case brown. And one more. And that's all it takes, just two little hits on there. This is now going to crest up a little bit, and it's going to turn a little grayish color, and in the space of about a few days to a week or so, it's going to fall off. You should have normal skin at this point. If we need to, we can go back and treat a second time. Another problem that the patients come to us for is excessive hair. In this case, hair on the legs, but we also take care of hair on the chin. We take care of under the chin, on the neck, on the chest, for backs, for guys that have a lot of hairy backs that want to have that. Underarms. My wife and my daughter have not had to shave their legs or the underarms in years. In this case, we're going to go ahead and treat legs. Again, looking at the brown, looking at the dark, it works on darker hair, not the light blonde hair. But again, this is an easy treatment. We walk right along and just treat all the hair follicles. Occasionally get a little ouchy, and it does smell like we're burning something, so that's hair that's dying. We love it. With our last patient, we treated the legs for the excess hair. Likewise with the gentleman, if you have increased hair on the face, especially if you have problems shaving, difficulties with that, we can remove hair that way. Again, the military does that quite frequently for the PFB. We also can do it on the back for excess hair on the back too. When we do this, we have to treat the hair that's in a growing phase. So the majority of the hair is in growth phase at a particular time. There is pigment down in the bulb, and so we actually use laser for energy. The pigment of the bulb picks up this energy and it cooks the bulb. The hairs in a resting phase aren't affected, so we need to repeat it about every 6 to 8 weeks. You come back in, we'll do another treatment there, and that'll take care of all those hairs that are in a growing phase at that time. Over the space of about a year, 4 to 6 times, we should have gotten the hair a couple of times in its growth phase, so we should have long-term hair removal. But besides working for the browns on the face and the blacks on the face, we also can work on the reds. Acne rosacea is a big problem in our clinic, and so we do have patients come in at the reds with the blood vessels, acne rosacea, and the redness on the rosacea. So this is a different laser, a pulse dye laser, and for this one we're going to be targeting reds. There is a little cool cryogen that's going right now. The reds on the nose, if you have blood vessels there, we can go ahead and treat that also. And usually one treatment is all that we need for the rosacea at one time. Myself, when my rosacea flares, they treat me, so probably a couple of times a year is a treatment for rosacea. Other patients might need a couple treatments. They have a lot of vessels in there. So again, if you're chasing colors, if you're having problems with the reds, with the browns, with the blues, come on by the office and see us. As you can see, the patient has a little jump here and there, but you don't see any marks. There's no downtime afterwards. There's minimal discomfort during the treatment, and we can go ahead and talk with you and see if you indeed are a good candidate for laser removal of hair or vessels, brown spots or red spots. Come by Renovus Medical Center and ask to speak with Dr. Clemens. We'd be happy to see you.